Welcome to today's video. We're tackling a hard, high-stakes topic: how to fund massive, recurring medical costs without destroying your long-term financial plan. We'll focus on a pragmatic, tax-savvy order of operations that prioritizes using your HSA First, then taxable brokerage, and saving emergency funds for last resort needs while protecting retirement accounts. We'll also cover insurance choices, income protection, and assistance programs. Let's move step by step, using clear visuals and examples, so you can turn a chaotic situation into a plan you can execute. Here's our roadmap. First, we'll frame the financial reality of catastrophic health events. Next, we'll explain why using the HSA First is typically the optimal move. Then, we'll lay out a recommended order for liquidating assets. After that, we'll examine insurance decisions, income protection tactics, and assistance resources. We'll end with an actionable checklist and a short quiz to reinforce the key ideas. Before we begin, remember this is educational content, not individualized financial, tax, or legal advice. Health savings accounts and insurance rules vary by jurisdiction, employer, and plan. Please consult your tax professional, HR, or benefits department, and a fiduciary financial advisor to tailor this strategy to your situation. Now, with that context, let's proceed. Let's face the reality. An aggressive diagnosis can immediately create large, recurring medical bills, often multiple years of five-figure deductibles and out-of-pocket maximums. In this environment, cash flow and tax strategy become critical. Every dollar you keep after taxes is more treatment-funded and less future debt. With that in mind, we'll turn to the central pillar of this plan: the HSA First approach. Here's why the HSA should be your first line of defense. An HSA offers a triple tax advantage. Contributions are pre-tax or tax-deductible, growth is tax-deferred, and withdrawals are tax-free when used for qualified medical expenses. In a catastrophic scenario, paying current qualified costs from the HSA preserves your after-tax assets and avoids capital gains you'd incur if you sold from a taxable brokerage first. For example, if you have $45,000 in your HSA, using it to cover 2 to 3 years of maximum deductibles can be more efficient than liquidating taxable investments. This is the exact moment the HSA exists for, even if you originally planned to use it in retirement. Now that we've established the why, let's move to the order of liquidation across all accounts. Use the HSA First for all qualified medical expenses until it's depleted. Next, use your taxable brokerage because it offers flexibility, though you may incur capital gains taxes. Third, preserve your emergency fund as long as possible. In a crisis, its purpose shifts from covering short-term job loss to bridging income gaps or non-medical emergencies when benefits lapse. Finally, avoid tapping retirement accounts such as 401(k)s and Roth IRAs, since doing so undermines compounding, may incur penalties, and reduces future security. With the sequence clear, let's translate this into immediate actions you can take. Here are concrete steps. First, document every expense and keep receipts to substantiate HSA withdrawals. Pay qualified expenses directly from the HSA, or reimburse yourself promptly if you need to pay out-of-pocket first. In taxable accounts, harvest losses where appropriate to offset gains. Segment your emergency fund into a treatment buffer and a household buffer to avoid mixing purposes. Coordinate with HR to deploy intermittent FMLA and short-term disability, which protect your job, income, and access to health insurance. During open enrollment, compare your current high-deductible plan to alternatives with lower deductibles, factoring in your expected utilization during treatment. Finally, apply for assistance programs, including state resources, condition-specific nonprofits, and Social Security disability insurance, using the Compassionate Allowance Track if applicable. Next, let's compare plan choices more deeply. On the left, the high-deductible health plan typically offers lower premiums and HSA eligibility, which is valuable in average years. However, the high deductible can be punishing during years of intensive care. On the right, a lower deductible plan often has higher premiums and is not HSA eligible, but it can dramatically reduce out-of-pocket exposure during treatment-heavy periods. For patients expecting ongoing, high-cost care, switching to a lower deductible plan during open enrollment can produce substantial net savings, even when HSA contributions cease temporarily. With that context, let's organize the liquidation order in a quick reference table. This table summarizes the accounts, their tax impacts, pros and cons, and how to use them. HSA withdrawals for qualified expenses are tax-free, so they belong first. Taxable brokerage follows because it's flexible, though it can trigger capital gains. Emergency savings provide liquidity without taxes, but should be preserved to maintain resilience. Retirement accounts fuel long-term growth and should be protected. Withdrawals can have taxes, penalties, and long-term consequences. Now, let's visualize an overall timeline for planning across multiple treatment years. This timeline shows year 1 beginning with diagnosis and using the HSA to meet the deductible and out-of-pocket maximum. Reimbursements are coordinated monthly. Short-term disability supports income for a defined period. And intermittent FMLA protects job and benefits during treatment appointments. In the fourth quarter, open enrollment triggers a comparison of plans, potentially switching to a lower deductible plan for year 2. In year 2, the HSA is exhausted by mid-year, and taxable brokerage sales are scheduled quarterly, integrating tax loss harvesting where feasible. The emergency fund is reserved for lapses in benefits or unexpected non-medical expenses. Assistance programs are applied to or renewed, and a comprehensive review occurs at year-end. Next, we'll include a funding mix snapshot to visualize proportions. This pie chart illustrates a conceptual funding mix for a catastrophic year. The majority of qualified expenses are paid from the HSA, a meaningful portion from taxable brokerage after the HSA is depleted, and only a small slice from the emergency fund. Of course, your exact percentages will vary, but the structure keeps taxes low, cash flow manageable, and resilience high. Now, let's convert all of this into a practical checklist with markdown-style boxes you can copy and use. Here is a practical, copyable checklist. Inventory your HSA and review the plan rules. Track every qualified medical expense and store receipts to substantiate HSA withdrawals. Set up an efficient workflow to pay providers or reimburse yourself quickly. In your taxable account, map positions, plan which lots to sell, and consider loss harvesting. Segment the emergency fund and define clear criteria for when it may be used. Work with HR to combine intermittent FMLA for appointment coverage and short-term disability for income replacement. During open enrollment, perform a cost comparison of your HDHP versus lower deductible alternatives based on expected utilization. Apply for assistance through state programs, relevant nonprofits, and SSDI if eligible. Finally, schedule quarterly reviews while in treatment so you can adapt as things change. Next, let's test your understanding with a quick quiz. Quiz time. In a catastrophic, high-cost treatment scenario, which account should typically be used first to pay qualified medical expenses? The options are A. Emergency savings, B. Taxable brokerage, C. HSA, and D. 401k or Roth IRA. You may pause the video now to think about the answer. We will discuss the answer in the next section of the video. The correct answer is the HSA. Using the HSA First for qualified medical expenses leverages its unique tax-free withdrawal advantage, preserves other assets, and avoids realizing capital gains in a taxable account. Now, let's consolidate the main lessons. The key points are straightforward. Use the HSA first, then taxable brokerage, while preserving the emergency fund and protecting retirement accounts. Optimize insurance choices during open enrollment, and pursue income protection through disability benefits and job protection via FMLA, supplemented by external assistance programs. With these principles in place, you can navigate a financially intense period more reliably. Next, let's summarize and wrap up. In summary, catastrophic care requires a disciplined cash flow and tax strategy. Use your HSA first for qualified medical expenses, then your taxable brokerage, preserving emergency funds for true last resort cases, and avoiding retirement withdrawals. Reevaluate your insurance during open enrollment, especially for high utilization years, and safeguard your income and benefits through disability coverage, FMLA, and assistance programs. Finally, let's close with a quick thank you and a call to action. Thank you for watching. If this video helped you create a practical, resilient plan for managing catastrophic medical expenses, please like the video, share it with someone who could benefit, and subscribe for more strategies. Share your experiences and tactics in the comments. Your ideas may be the missing puzzle piece for someone else facing the same challenge.